Welcome to a special episode of the Exam Room Podcast brought to you by the Physicians Committee in conjunction today with Washington Healthcare on Wednesday, or better known as WOW, MSDC's weekly program devoted to informing and connecting physicians in the Washington, D.C. region. I'm the weight loss champion, Chuck Carroll, and riding shotgun with me today on this highway to health is Dr. Neal Barnard. He is an MSDC board member and an alternate delegate for MSDC's AMA delegation. And with that, we welcome Dr. Barnard to the show. Thank you so very much for being here today, my friend.
Hi there, Chuck. It's great to be with you today.
It's great that you are here because it is February, and that means American Heart Month. A lot of people are talking about heart health. And so that is why we are pleased to bring you this special edition of WOW titled, What Patients Wish Their Doctors Knew About Foods and Heart Health. You know, I can think back to being a patient myself and always being given this vague prescription for just go on a healthier diet, make sure that you include more fruits and more vegetables. But that was about the extent of it. And when I was overweight, I didn't really know what to quite make of that. So I'm glad that you're here today to kind of clear up some of this confusion. And as a matter of fact, we've gone through, Dr. Barnard, and picked out 7 of the most asked questions when it comes from patients to their doctors about heart health, if you're up for answering them today.
Let's do it.
All right. Well, the first question is a really good one, and it's probably where a lot of people start. And that is, do high blood pressure and high cholesterol always have to be treated with medicine?
You know, this is a huge question because patients are handed a prescription. They think, do I really have to take this? And it should be said right up front that blood pressure lowering medications and cholesterol lowering medications are powerful, effective, and sometimes life-saving. But on the other hand, some patients may be able to do without them. And let's start with a classic research study that got everybody's attention back in the late 1990s, the DASH study, Dietary Approaches to Stop Hypertension. They were taking advantage of the observation that certain people following certain kinds of healthy diets really tended to have really healthy blood pressure. They brought in a large group of people, more than 400, and they asked them to do different things. Increase fruits and vegetables, reduce meat, reduce fat. Let me show you the results. Okay, keep in mind, we're going back here more than 2 decades. The top curve that you see here is systolic blood pressure in patients who didn't do anything. They're in the control group. And as you can see, what happened to their systolic blood pressure? Not much of anything. The second line is people who increased fruits and vegetables. And as you remember, fruits and vegetables naturally have little sodium, a lot of potassium. Okay, their blood pressure comes down a little bit. Then that bottom line there, that's the systolic blood pressure of people who do 2 things. They're increasing their fruits and vegetables, but they are also reducing meat, reducing fat. And what happens? Their systolic blood pressure drops really quite significantly. Now, same with diastolic. These are the same changes in diastolic blood pressure, and the drop in blood pressure was noted within 14 days. So it's very, very fast. And a lot of these folks are not going to end up on blood pressure medications at all. Let me say a little bit about how this works. Okay, you know that sodium raises blood pressure, right? It increases the blood volume. Okay, and there's a lot of sodium in some foods, but not really so much in plant-derived foods. Okay, even look at that potato at the bottom, 13 milligrams of sodium in an entire potato, that's almost none. But turn that potato into potato chips, that's where the sodium comes in, 330 milligrams. Even worse, cheese, huge amounts of sodium in cheddar, in Edam, in Velveeta, lots and lots of sodium. You want to get away from those kinds of foods. The other thing, and this is something that seems to have been omitted from many doctors' medical education, and that's the effect of, can I just put it this way, grease on your blood pressure. Fat in foods, particularly the thick, saturated fat, causes your blood to become more viscous, more thick. It takes more effort for the heart to push it along and to create proper circulation. On the other hand, avoiding fat, as they were doing in the DASH study, reduces blood viscosity, increases blood circulation, and reduces blood pressure. Okay, so what are we doing with the plant-based diet? We are reducing sodium, exchanging it for blood pressure lowering potassium. We're also reducing blood viscosity, and that helps lower blood pressure too. And these very same changes We'll also tackle cholesterol, because vegetables and fruits don't have any cholesterol. They don't have any animal fat. And when people go toward a more plant-based diet, their blood pressure comes down, their blood cholesterol comes down pretty predictably. Will you be able to do without medications? You've got to monitor your patients and see where they are. If they're not at target, you may have to add medications. If they reach target, you probably don't. So back to you, Chuck.
The next, well, I think that the natural follow-up to that would be, is a question that we get asked so often on the show is, well, what about eating out? You know, so many of the patients, they want to eat out, they want to enjoy time with their friends, their family, but you go out to eat and you know that oftentimes those menus are just loaded up with sodium. So what advice should doctors be giving to patients on that end?
Well, the lesson from the DASH trial really was, you want to do two things. You want to increase vegetables and fruits, because no matter how you do it, you're going to be getting more potassium in your diet. But the lower sodium varieties, as you're hinting at, are always going to be better. But don't just add vegetables and fruits. Get away from the meats and the fatty foods to the extent you can. So if you're going out to eat, the more you have a plant-based option, the better off you're going to be.
All right, so let's turn now to another big issue that a lot of people have, and that is diabetes. And obviously, we know that diabetes leads to heart disease there. So, can diabetes also be reversed?
Happily, the science on this has moved along enormously, and our own team has been instrumental in that, if you don't mind my saying so. Back in 2003, NIH asked us, gave us a grant to look at a better approach to type 2 diabetes. We brought in a large group of people. Half of them went on a completely plant-based diet. The others went on what I'm going to call a conventional diet. And the conventional diet meant limit calories, you know the drill. Don't eat too much carbohydrate, avoid bad fat, meaning saturated fat and trans fats. That was the conventional approach. The experimental approach was a plant-based diet, meaning no animal products at all. So it was vegan, no meat, no dairy, nothing. Oils were kept low too, and we favored low glycemic index foods. Now, for practitioners who are not too sure what that means, white bread tends to spike your blood sugar. That's high glycemic index. Rye bread is more gentle on your blood sugar, pumpernickel even more so. That's lower glycemic index. So the low glycemic index foods are things like pumpernickel bread, beans, in fact, all the legumes like lentils and peas, very good. Fruits, surprisingly, even though they're sweet, they're pretty low GI2, meaning they don't spike your blood sugar too much. Okay, so no animal products, minimize oils, low glycemic index foods, and what happened? Looking at hemoglobin A1C, as you know, we want it to be below 7 for people with diabetes. Our people were around 8 to start. And the red line here shows the conventional diet. They did well. They had a drop of about 0.4 absolute percentage points. But the blue line were the people on the plant-based diet. They dropped 3 times more, by 1.2 absolute percentage points, or even a little bit more. And that really showed that you can get diabetes under control. And I want to show you, this is Vance. Vance was one of our very first research participants. And he went on a plant-based diet, described it as surprisingly easy because he didn't have to count calories or count carb grams. He lost 60 pounds over about a year on the plant-based diet, stopped his diabetes medications, got his A1C down from 9.5 to 5.3. And this taught us a lesson, that in some of our participants, we're going to start seeing something with this more powerful dietary approach that we weren't used to seeing, and that was diabetes going away for all intents and purposes. Now, Velveeta is waiting around the corner, so as are all kinds of other unhealthy foods, so you can get diabetes back. But what we do see many people who get to target without medications if they follow enough of a diet change. Now, the word reversal is not really a technical term. It's just the way the patients think that I don't have diabetes anymore. So the short answer is yes. For many people, the diabetes will improve to the point that you would never know they had it. But diabetes is a serious condition. And if you don't get there with diet alone, you'll want to think about medication for absolutely.
Now, let's go ahead and talk about type 1 versus type 2 diabetes. In the study that Vance participated in, that exclusively type 2 diabetic patients, or were there type 1 diabetics participating as well?
That was all type 2. But you're anticipating something really important, Chuck, which is that people with type 1, which, as you know, I mean, they effectively don't have insulin in their body anymore because the pancreatic beta cells are gone. People with type 1 have been experimenting with the same diet. It will not eliminate their need for administering insulin, but it will very likely reduce their doses. We have seen, in fact, we recently published a case report where we saw a number of patients who were changing their diet to adopt this low-fat plant-based diet that was designed for type 2, but they're applying it to type 1, discovering that their insulin requirements drop sometimes 30 or 40%. Why is that? What we believe is happening is that they really have two conditions. Their body isn't making insulin, but also their muscle and liver cells have a measure of insulin resistance, and that's what the diet is addressing probably. The other piece of this for type 1 is what kills you with type 1 diabetes. Similar to type 2, it's cardiovascular disease. And you don't want a drop of cholesterol or animal fat in your diet. You want to baby those arteries. So a plant-based diet is very clearly established for type 2 diabetes, but also I would say the diet of choice for type 2.
Now, you're talking about a plant-based diet. Obviously, that's going to contain fruit, all right, complex carbohydrates. But I know that a lot of times physicians and patients alike are scared to introduce that into their diet because it does contain sugar. What do we know as far as eating whole fruits when you do have type 2 diabetes, or type 1 for that matter?
This is going to surprise people, but I'm going to say fruit gets a complete green light. It does have natural sugars in it, but it is generally speaking low glycemic index for most varieties of fruit. And for people to say that their whole approach to controlling diabetes is to focus on minimizing natural sugars, they're missing the point. In fact, Chuck, let me bring you back my slides. I want to show you really the cause of the insulin resistance. That is the fundamental part of type 2 diabetes. This purple oval is a cell. Let's call it a muscle cell. And that muscle cell, as all practitioners know, it's insulin resistant. It's not responding to insulin. Okay, so here's the deal. Muscle cells function on glucose. That's their normal fuel. But that glucose cannot penetrate the cellular membrane. The glucose approaches, it just effectively bounces off. So to get the glucose into the cell, I need a key. And the key is insulin, and it attaches to a receptor on the cellular surface. That insulin key then activates the receptor that then causes little channels to open up on the surface of the cell, and the glucose enters. That's normal glucose metabolism. So what could go wrong? What goes wrong is that here in America, my dinner looks like that, and my lunch looks like that, and my breakfast looks like that, and there's a lot of grease in my foods. And if you add it up, there is all kinds of fat in these foods. And so with a fatty breakfast and lunch and dinner, the fat will build up inside the cells. This is microscopic accumulations of fat referred to as intramyocellular lipid, fat inside muscle cells. The same thing happens in liver, hepatocellular lipid. We can measure it with magnetic resonance spectroscopy. And the more this fat builds up inside the cell, the more you have insulin resistance. So the insulin key, if you will, still attaches to the receptor. It doesn't work. It doesn't work. The insulin is non-functional. The cell is insulin resistant. So let's say I do what the research participants did. I get the animal fat out of my diet. I keep the vegetable oils to a bare minimum too. And what happens? The fat dissipates. And as the fat goes away, the insulin can return to normal activity or close to it. And then your insulin is functioning again, the glucose comes back into the cell, and everybody is happy. So my point is that when you get the fat out of your diet, stop worrying about whether you have an apple or a peach or a pear. Get the grease out of your diet. Get the animal products out. Keep the fried junk out. the fat that's built up in the cells will start to dissipate. Your insulin sensitivity will return. Your insulin resistance starts to go away, and your blood sugars will fall. And that's why the low-fat plant-based diet is much more effective than the more conventional approach.
And you cited some meat on there, particularly chicken, which is viewed as being a health food, more or less, but it has more fat in it than people would suspect, regardless of whether or not it's baked or fried or however it is that a person is cooking it, correct?
Yeah, Americans eat more than 1 million chickens per hour. They are laboring under the idea that this is somehow healthier than a burger, and you could make an argument that it is, except when you look at the numbers. Take chicken breast, throw away all the dark meat, take off the skin, and that chicken breast is still almost a quarter fat as a percentage of its calories. And that chicken fat will lead to insulin resistance, just like beef fat will.
All right, let's move on now and talk about another big chronic disease that is plaguing so many of us here in America, and that is heart disease. So we've talked about diabetes and the benefits of changing your diet there. Now let's talk about heart disease and whether or not that can in fact be reversed. What do we know about that?
Yes, this is really, I think, one of the most exciting things that has occurred in research in the past 30 years. We talked about, the first question was about, can I lower my cholesterol and my blood pressure without medications? The second one was about diabetes. All three of those actually feed into heart disease. And so if I'm controlling those three risk factors, I'm going a long way toward improving heart disease. And this whole question of reversal was put to the test back in 1990. Let me show you. Dr. Dean Ornish, a real medical genius, if you ask me, working in California and with the University of California, San Francisco, brought in people who had had angiograms for current heart disease. And his question was, can I make that ugly looking artery that you see at the bottom look like that nice clean artery that you see at the top? And he wanted to do this not with surgery, not with procedures at all, and not with medication, but with diet. So he did 4 things. Vegetarian foods, and we've already seen their benefit for cholesterol and blood pressure and for diabetes. Half-hour walk every day. That sounds easy. Manage stress. I guess that's why he didn't do the study here in Washington, D.C. Just kidding. Avoid tobacco. But that was the whole program. So he brought in people, they had heart disease, plant-based diet, regular walking, manage stress, no smoking at all. And at a year, the results were phenomenal. Total cholesterol dropped 24%. Good. LDL cholesterol, 37% drop. This is kind of statin territory, but this was done without medication, just with diet and lifestyle. Your average person lost 22 pounds in a year. But what really made history with this study was that everyone had a repeat angiogram at 12 months. And they then measure the tiny little trickle of blood that gets through the coronary arteries. And they found that the arteries were actually reopening to such an extent that you could see a measurable improvement in 82% of patients in the first year. And so that really made medical history, and that also made Medicare decide that they would pay for this program for people who wanted it. So yes, the short answer is heart disease can be reversed.
And so here's the interesting thing. I remember speaking with Dr. Ornish a couple of years ago at the International Conference on Nutrition and Medicine, and like you, was just absolutely blown away by his research. But I think that for a doctor or physician who's watching this right now and the idea of a plant-based diet may be new to them, I think it's also important to point out that you have major dignitaries who have adopted his practices and seen improvements in their own health, right down to and including former President Bill Clinton, who has just dramatically improved his own health by working with Dr. Ornish. You know, when President Clinton first got into office, he was notorious for stopping by the McDonald's right by the White House. And then he got into some health troubles and now has changed his ways with Dr. Ornish and is just doing phenomenally.
Yes, I think the question that you've raised, Chuck, is really important. Is it easy? Is it acceptable? Will people do it? And some of the evidence comes from the fact that people that everybody knows have had tremendous results with it and really embrace it. But I asked that very same question when these results were about to be published, prior to that, I was working at the George Washington University over there in what used to be called the Burns Building, and at Pennsylvania, 22nd. And I called up Ornish, and I said, every doctor is going to agree that this will work because you're taking the cholesterol out of the diet, you're taking the animal fat out of your diet. But doctors will say, or they'll imagine, that nobody will do it. Nobody will adhere to it. It sounds too strict. So Dr. Ornish invited me to come out to California, and I actually did a follow-up study with him that was published in 1992, where we asked all of the patients in both the experimental group and the control group, how do you feel about the foods you're eating? How much trouble is it to make them? What do you think you'll do in the future? What does your family think? And what we found actually was that, first of all, the control group, which was not following a vegetarian diet at all. They were following sort of their doctor's best guess. Take the skin off your chicken, eat more white meat, less red meat. The control group grumbled. They said all the joy of life was gone, no more steak, no more cigars, and they weren't getting any benefit. They weren't. Their cholesterol levels weren't really changing in the control group. But in the intervention group that was going vegetarian and so forth, they grumbled. They said, they did have to learn some new tricks in the kitchen. How long did it take you to get used to a new diet? They said, about 4 weeks or so, 4 or 5 weeks. They felt totally used to it. And because they were losing weight and their chest pain, those who had angina, it disappeared, about a month, something like that, or sooner in many cases. Their angina was just gone. And I got to tell you, your dinner tastes really great if your heart isn't killing you. And they came to really, really embrace it. And now Dr. Ornish has had patients who have followed this for years, even decades. And people's tastes accommodate, and they come to really like these foods very much. It doesn't mean that some people may not goof up a little bit, but a lesson that I learned is that if you tell your patient, just do a little bit, make a little change, take the skin off your chicken, no patient will go further than that. But if you say, I want you to follow a completely vegan diet, that's the healthiest. Some of your patients will do it. Some patients will get closer to it, but they will do a whole lot more than if you ask them to just make a halfway step. It's sort of like if you say to a patient, cut down on smoking, nobody's going to quit. Some of them will cut down, some won't. If you say to the patient, let me encourage you to quit smoking, some patients will, some might cut down, but they're all going to be better off than they would have been if you asked them to just do a halfway measure. So bottom line, patients embrace the diet. Lots and lots of people are doing it, and Medicare will pay you to administer it.
And that can be such a tricky one. And I know this from being 420 pounds at one point in my life, is that when a doctor approaches you with the idea of doing something, it can seem overwhelming at first. Absolutely. If the doc says, push all of your chips to the middle of the table, just go all in on this, there's going to be that natural resistance. Personally, from experience here, I can tell you that I did not have success until I did push every single last one of my chips into the middle of the table and go all in. The halfway measures, just as you suspected there, did not necessarily work the greatest for me, but it did kind of ease my mind into the idea of being able to do this. And so it was an important step, but it certainly was not the solution. Does that make sense?
Yeah, it sure does. Let me provide a little motivation for any doctor who's saying, I'm not so sure. This is an image that you're seeing now. This is actually the image of a Cleveland Clinic surgeon. This is an angiogram of the chest of a surgeon at the Cleveland Clinic. And what you see here is something that nobody wants to ever see. This is a diseased distal left anterior descending artery. This is a killer. The surgeon in this case was the patient. He could not be stented because it was anatomically too extended, and he could not tolerate statins. What's left? What's left is a low-fat vegan diet. He had no lipid-lowering medications. He followed the diet for 32 months, and this is his angiogram. I got to tell you, the ability of the body to heal is remarkable. Now, this does not mean that you just send the patient on their merry way and you don't monitor them and you don't use medications when you can. You do, but the diet effects can really be very strong. On your question to halfway measures, let me tackle that directly, Chuck, if you don't mind. The Mediterranean diet is a very sexy sounding diet that rolls off the tongue very easily. Okay, let's follow the Mediterranean diet. Sounds fun. Ansel Keys at the University of Minnesota came up with this term, Mediterranean diet. I think because Southern Italy sounded a lot more inviting than Minneapolis, perhaps. And he had something to say for it. When you look at the relationship of fat intake, which is here on the x-axis, to heart disease deaths, Italy looked pretty good. It's on the lower left. Look at the USA, upper right. A lot of fat in the diet, pretty high rate of heart disease mortality. Canada, Australia, England, a little bit better. Italy, much better. Not as good as Japan, but still pretty good. So he came up with this idea of the Mediterranean diet to focus on the diet really of Southern Italy, and defined, meaning plant foods, not too processed. Your dessert would not be pudding, it'd be fresh fruit. Instead of butter, you'll use olive oil. Not too much dairy, not too many eggs, not so much red meat. Have some wine. That was kind of the idea. And he modeled it after the town of Nicotera in Italy. So researchers have put this to the test. Okay, it's not vegan, it's not even vegetarian, it's just sort of going in that direction. What do they find? The Predimed study in Spain brought in 7,000 people, more than 7,000. They were all at risk for heart disease, 90% of them were overweight. And 1/3 of them followed the Mediterranean diet that I described, plus olive oil. Another third, Mediterranean diet plus nuts. Another third, control. No diet changes at all. What did they find? Well, when you looked, the foods that they recommended, oil, nuts, fruit, vegetables, fish, legumes, sofrito, which is a Spanish kind of a tomato sauce, and they were getting away from the more unhealthy foods. Okay, what did they find? With regard to weight loss, they found a lot of nothing. The Mediterranean diet was not effective for weight loss. The weight loss over 12 weeks was 1/4 kilogram on average, not good. And when it came to mortality, all-cause mortality or cardiovascular mortality, in neither case did they get a p-value below 0.05. In other words, there was a suggestion of an improvement for the oil group, but it was not statistically significant. So the researchers were pretty disappointed that this Mediterranean diet, even though the people were overweight, they weren't losing weight, and mortality wasn't changed after many years on the diet. So they did come up with a composite of any kind of cardiovascular event, a myocardial infarction, stroke, death from cardiovascular disease. And they did see benefit. Control group, 4.4%, olive oil down to 3.8, nut supplemented down to 3.4. Okay, great. This is not really a cause to crack open the champagne, but there's something there. And that has kind of been the basis for the Mediterranean diet that people have been cheerleading about. Really, it is nothing like what Ornish achieved. However, some of the Predimed researchers did a really good thing, is they noticed that among these 7,000 and some people, some of them were following what they called a pro-vegetarian diet, meaning they were really emphasizing fruits and vegetables and nuts and so forth, and they really weren't eating a lot of meat, maybe none at all. Among these 7,000, there are people pretty much getting toward vegan. Well, they then devised a pro-vegetarian scale and applied that to their numbers, and let me show you what they found. The more you went toward a plant-based diet, the lower your risk of all-cause mortality, and it was highly statistically significant. And for cardiovascular mortality specifically, same story. So the Mediterranean swell gets you a little ways, but when you're really bringing in the plant foods, getting away from the animal product, you're going to do better. So our research team, let me finish with this. We just published these findings from a study where we brought in 62 people, and half of them began a Mediterranean diet, half of them began a vegan diet, and after 16 weeks, they switched diets. So every patient did both diets, and we could compare. And what we found was as they began, the vegan group was losing weight really very well. This is the first 16 weeks of the study. The Mediterranean group just inching down in their body weight from what, 97 to about 96 kilograms over 16 weeks, not good. Then they stopped for 4 weeks, and then they switched diets. Now the Mediterranean group is now vegan. They're going vegan. Look at that. Suddenly their weight loss kicks in. But the group that had been vegan is now Mediterranean. What's happening to them? Their weight is coming back on. So the way I'm going to interpret this is that the Mediterranean diet is just nothing like a plant-based diet and should not be prescribed for people for whom weight loss is a goal or for whom cholesterol lowering is a goal. It's just too weak to help. I will say that when it comes to total cholesterol and LDL, vegan diet dramatically better than a Mediterranean diet. But when it comes to blood pressure, I do want to say that there was some effect of the Mediterranean diet, 9 points on systolic, 7 points on diastolic, that actually was better than vegan. Don't know why, but it's not as if the Mediterranean is a complete bust. It's just not as powerful.
Well, I see the question right there on the screen. So that is another big one that I think I was personally alarmed when I heard a report that artery disease is beginning younger and younger and younger. We're seeing that as the obesity epidemic continues to rage here in the States. So at what age really are we starting to see artery disease begin in patients?
I have to say, Chuck, this is one thing that blew the scientific community away. And the research that was really pivotal here came from Australia. It was done by Michael Skilton and his group, and they looked at birth. What you're specifically doing is with totally non-invasive sonography. You can measure the aorta wall thickness in newborns. And the researchers compared mothers and who were overweight and mothers who were at a normal weight for pregnancy time points. And those women who were particularly overweight, more so than one would expect during pregnancy, gave birth to children with thicker aortic walls. Meaning, what we believe is happening is that the maternal diet was affecting the infant, the growing infant, such that the arterial changes were occurring in gestation. So it's a peculiar thing to think of, but heart disease we should consider as actually starting at birth or even beforehand. And the way to think of it, it's a dynamic process. The attack on the artery walls can wax and wane. The artery disease can get worse, it can get better. But what is not the case is that the heart attack that arrived in a man of 55, it didn't start when he was 53. Those artery changes have been there since he was a child, a teenager. It's been starting and growing. And finally, when he's 55, he blows open one of his atherosclerotic plaques and ends up with an MI. No, this is a lifelong disease process.
And let's talk now about let me think about how best to phrase this. Let's spin this and put some hope on it. So let's say that somebody has unfortunately had this for a number of years, decades even. What effect will they see if they make diet modifications, even if they have had these clogged arteries now for more than 20 years? Can they still see some benefit?
Oh, yes. Ornish's work, our work, and thousands of people have been doing this. And age does not seem to be a barrier. In other words, when a person has narrowed arteries, if they follow this healthful diet and lifestyle, get the animal products out, build your diet from plant-based foods, you've got to quit smoking, not optional, and do lace up your sneakers to the extent you can. And you can also add medications if you need them. Age does not seem to be a barrier. The ability to stabilize the arteries, to reopen them, to feel better, clinically does not seem to be limited by age. I want to tip my hat to Caldwell Esselstyn at the Cleveland Clinic, who has done a lot of work in people with really quite severe artery disease, showing that if they make sufficient dietary changes and lifestyle changes, I can't say you become bulletproof, but it is surprising to see the degree to which this disease can be improved and to which further cardiac events can be prevented.
And then back to the heart disease at birth, just to kind of put a bow on this, safe to say here that the idea of an expectant mother having, free range to eat whatever she wants, probably not the best idea anymore.
Not at all the best idea. And unfortunately, expectant mothers get all kinds of unsolicited advice from all kinds of people, and sometimes they get not such great advice about what they should eat. And as I remember from my own medical education, we were really not taught very much about how to manage a pregnancy with regard to the nutritional needs of the mother or of the infant. And the old idea was make sure you're eating enough. And so people will throw all kinds of unhealthy things at pregnant women as if they're forgetting that although you're eating for two, one of you is really very small. You don't need a huge amount of overnutrition for that child. And the best evidence we have is that the same plant-based diet that's good for an adult also is appropriate for an adult who is pregnant and is growing another baby. You do need vegetables and fruits and whole grains and beans, and you need your prenatal vitamins. That's not optional. You need the B12 and so forth, and that should continue while you are hopefully breastfeeding. But the whole idea that you just need red meat for iron and so forth, that's gone out the window quite a long time ago.
Let's pivot now back to diabetes. There was this notion that type 1 was childhood diabetes and type 2 was adult onset diabetes. But what is the data showing now as far as when diabetes actually begins? At what ages are we talking about here?
For type 2 diabetes, we used to describe this as the disease for the over 40s. And I have to say that every clinician in practice is now horrified to see that people of 14, 15, 16 developing type 2 diabetes, and many more with pre-diabetes. So let's go up to New Haven, Connecticut. Kit Peterson and Jerry Schulman at the Department of Endocrinology at Yale brought in 26 healthy volunteers, and they did glucose tolerance testing on them and found that some were insulin sensitive, normal, some were insulin resistant, and here is the age. Okay, they're not over 40, they're not over 30, the average age in the 20s. They're not overweight either. Look, average weight, 132 pounds, 141 pounds. These are skinny people, young people, and they did not have diabetes. These are healthy A1Cs. But what do? Through MR spectroscopy, magnetic resonance spectroscopy, we can now look into the muscle cells and into the liver cells. And let me show you what we found. Every dot here on the left is a person. And we're looking at the intramyocellular lipid, the fat inside the muscle cells of these individuals. And these are the healthy individuals, and these are the insulin-resistant individuals. Now, as you know, the buildup of lipid inside your muscle cells is going to distort your mitochondrial activity. This is the healthy mitochondrial activity of the healthy controls and the diminished mitochondrial activity of the insulin-resistant subjects. What am I saying? These are young people, late 20s. These are thin people. They haven't developed a lot of excess weight yet, and they don't have diabetes. But the disease process is beginning, and it's manifested as increased lipid inside their muscle cells, which you can measure, and it's already affecting their cellular biochemistry so that their mitochondria are not functioning as well. That means insulin resistance. So diabetes diagnosed at 35 or 40 was insulin resistance beginning, 15 years earlier or something like that. You can see insulin resistance in teenagers now. They may not have diabetes yet, but the disease process begins very, very early. It begins very often in childhood. That's the bad news. The good news is our team worked with Kit Peterson and Jerry Schulman and used a plant-based diet in individuals who were insulin resistant. We used a plant-based diet over 16 weeks. We just published our findings in JAMA Network Open. Our patients got on the Amtrak train. They went up to New Haven and they went into the MR scanners, and you can show that intramyocellular lipid dissipates to a great degree, and the hepatocellular lipid dissipates as well.
And Let me pose the same question to you about diabetes that I did with heart disease. Diabetes, a chronic illness. People think that once they're diagnosed with it, they're going to live with it forever, and for many people, they do for years and years and years. What do we know about the effectiveness of changing one's diet, making improvements there versus how much improvement they can see down the line? Is this a case of it's best to tackle this sooner rather than later?
Yeah, you want to tackle it right away. Hope tackle it at diagnosis, or hopefully before, if you can prevent these conditions by helping your patients eat in a more healthful way. I grew up in Fargo, North Dakota. My dad was an internist at the Fargo Clinic, and he specialized in diabetes. I never heard him say that a patient with diabetes got better. The goal was just to minimize the complications. Our research and that of others has changed that scenario. We now know that if patients make enough dietary changes, this disease can improve quite dramatically and sometimes, for all intents and purposes, go away. That said, we respect this disease process in that it can be dangerous and the side effects can be catastrophic. So we want to make sure that we work really hard to support our patients. We also don't labor, we don't force our doctors to labor on this alone. They need a team. They need a good dietitian to guide the patient in making these dietary changes. And hopefully they have a series of classes or other support that allows the patient to change.
Well, there we go. And it is important, I should note that the patient and the doctor work very closely together, especially if you are beginning to see those improvements. You don't want to just drastically come off of all of your medication at once. You're going to want to wean off of that. So that's something that doctors are going to need to closely monitor, correct?
Oh, absolutely. It is very, very often the case. It's the rule, really, that when a person is on insulin and they begin a very low-fat, healthy, plant-based diet, a healthy vegan diet, often within a matter of days or a week or two, you'll start to see hypoglycemia because the person no longer needs the dosage of insulin that they had been on previously when they were on a less healthy diet. So the doctor has to work with the patient to back them off their medications. That's true for insulin, it's true for sulfonylureas as well. So make sure you teach the patient how to recognize hypoglycemia and make sure that you are available to bring their medications down. Also counsel the patients that not everybody gets better really quickly. So you don't want to throw your medications away. You want to work together and use the appropriate amount for the patient.
All right. So now we've got all of that out of the way. That brings us to the seventh and final question. And that is, now you've seen the evidence, you've seen the science, you're ready to get on board with that. But how do you start that healthy diet? Where do you start, Dr. Barnard?
Okay. We have developed a method that we've been using at the Barnard Medical Center. And it relies on helping the patient to adopt as healthful of a diet as possible. So that means fruits and grains and legumes and vegetables. Don't forget your vitamin B12 because you need it for healthy blood and healthy nerves. You don't need much, but you need 2.4 micrograms a day. So healthy diet, plant-based plus B12. Sounds like a tall order. Break it into 2 steps. And so when I'm counseling a patient, I will say to the patient, here's the evidence why it works. That takes maybe 90 seconds or 2 minutes to describe how a diet will help their diabetes. Then you ask the patient to take a week and don't change their diet for the next 7 days. Just check out the possibilities. I give them a piece of paper, and the piece of paper says breakfast, lunch, dinner, snack, and their assignment, fill it out. Just think of things that have no animal products in them that they might like. And then our dietitian will sit down with the patient and his or her reluctant spouse, and they'll start filling out the list together with breakfast items. And then they'll think about lunch items that they might like. And if they don't like them, they don't write them down. But if they like them, fair enough. And they start thinking about restaurant food that might actually not have animal products at all. And there are, in fact, lots of choices from Italian to Latin American to Chinese rice, tofu, vegetable dishes. You can go to a sushi bar and they'll make you a cucumber roll and an asparagus roll and a sweet potato roll and miso soup and so forth. So the patients are discovering that even fast food chains have some things that are healthy and don't have animal products in them. Okay, patient comes back after 7 days, they've got their list. Step 2, try it for 3 weeks. And the patient says, what? Go all vegan for 3 weeks? Yeah. The patient says, easy. I already got my list. That's no problem. I can do anything for 3 weeks. At the end of 3 weeks, the patient comes back And two things will have happened. Physically, they are healthier. Their cholesterol is coming down, their blood pressure is coming down. If they've got diabetes, their glucose is coming down. But the other thing is that their attitude about food has changed. Unlike every other diet that was kind of drudgery, this one is sort of an exploration for them. Their tastes are adapting. They're seeing new products and new books and new recipes and new websites and new apps and things, and it really becomes fun for them. So break it into 2 steps, check out the possibilities for a week, then a 3-week test drive. And if your practice does not have a good dietitian to refer to, get one, because they will do the heavy lifting for you and you can take the credit.
Phenomenal point. And my last question to you is this. Say that there is a physician who is watching this, listening to this right now, and they're still maybe just a little bit skeptical of the idea of promoting the idea of eliminating all animal products from a person's diet. What would your suggestion be to that physician? Would it be kind of the similar advice that you just recommended to patients, where you just give it a test drive and see what happens?
Yeah, I think that's right. And doctors should try it themselves as well. And what you often discover is that other diets you've been doing are sort of circling around it. As we've described, a Mediterranean diet, a DASH diet, are sort of semi-plant-based anyway. And the results are not usually super impressive. And when people go further, they're really delighted about it. Keep in mind, the patient is the person who's got the heart with the disease. That's a person who wants to live. And when we can give them tools that they can put to work, they are so grateful to you as the practitioner. Now, they may decide not to. That's okay. You don't fire them from your practice. You still care about them, but give them some tools, give them some support, give them somebody that they can call when they have questions. For us, that's our dietitians. But they will really thank you. We are now with food where we were a generation ago with tobacco. I remember as a resident at GW, we talked a lot about cutting down and so forth, and quitting seemed kind of extreme. That's where we are now with food. To quit eating steak sounds extreme, but those people who do, their hearts are pretty glad about it.
Absolutely. Well, Dr. Neal Barnard, thank you so very much for joining us here. A special episode of the Exam Room for Washington Healthcare on Wednesday. My friend, greatly appreciate it. As always, this has been so enlightening.
Thank you, Chuck.
If you feel like you've raised your health IQ by a couple of points, go ahead and subscribe to this channel and leave a nice comment below. And to hear the entire interview, head over to Apple Podcast or wherever you get your shows from and subscribe to the Exam Room by the Physicians Committee. And please leave a 5-star rating.